The University of Alabama Birmingham held a virtual press conference this morning to provide updates on COVID-19 trends we're seeing locally and nationally. Chelsea Barton is live in our newsroom with those details. Chelsea.
Well, and unfortunately, the data presented during that press conference this morning was not headed in the right direction. Wednesday, the United States reached a new record number of new COVID cases reported throughout the country in a 24-hour time period.
Just shy of 140,000 new cases, and that was accompanied by almost 1,500 people who were reported to have died of this infection.
The other discouraging high we've reached as a nation is the number of hospitalizations.
We now have almost 62,000 people hospitalized in the United States with COVID-19 as of yesterday. Areas like Huntsville, Tuscaloosa are all experiencing a burden of hospitalizations. Yesterday, we had 1,206 people hospitalized. And to give you some context for that, last August, when we were seeing that post-July 4th peak, we had 1,500 people hospitalized, and we were getting very, very anxious at that point. So I am quite concerned that we could be heading in that direction.
As the first holiday season of the pandemic approaches, UAB's Dr. Jeanne Marrazzo says she fears there will be future spikes if people do not take specific precautions now.
Well, the safest thing, to be perfectly honest, is not to gather in groups that you haven't been cohorting with throughout this thing. So if you want to go home to your parents or to your friends or your family, to people you haven't seen, recognize that it is going to pose a risk in both directions. You may unknowingly bring asymptomatic infection home, and you may acquire infection when you're there and then bring it back. This is an incredibly communicable infection. I've heard of clusters of cases now where the attack rate is astonishing in people who have been in the same room, particularly restaurants, gyms, and bars and churches. If you do it, just remember you've got to be incredibly thoughtful, and all the things we've been talking about, mask wearing, hand hygiene, and social distancing, need to be incorporated.
And Dr. Marrazzo says it's important to remember that at this time there is no vaccine for COVID-19. Although there is much hope surrounding a vaccine, she says that no one should alter their behavior or stop practicing the guidelines put in place to help slow the spread of this disease. Reporting live from our newsroom tonight, I'm Chelsea Barton, WVUA 23 News.